Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
home management or management of acute severe malnutrition. In home management, we have to give 4 A's. That is, amoxicillin should be given for 5 days. Albendazole single dose is given for children more than 2 years of age. Vitamin A is given in the presence of clinical vitamin A deficiency, that is 1 liter units. Age appropriate vaccines and also ready to use therapeutic foods are given. Ready to use therapeutic foods contain 175 kilocalories per kg per day, or we can also give home used foods. Contents of ready to use therapeutic foods are peanut paste, sugar, milk solids, and vegetable oils, along with minerals, vitamins, and antioxidants. So, these ready to use therapeutic foods can also be given. Then, hospital management of malnutrition.
thank you and thank you for watching.